There are many potential risk factors for the onset of perinatal depression. Overall, it's most likely that perinatal depression occurs in a group of women who are already susceptible to affective disorders, in combination with several known risk factors. For example, one of the strongest predictors of perinatal depression is a history of affective illness, in particular major depression. Additionally, antenatal depression, or depression that occurs in pregnancy itself, is one of the strongest risk factors for postpartum depression. Also, a history of untreated anxiety disorders in pregnancy is also a significant risk factor for postpartum depression. But psychosocial factors are also very important, including domestic violence, lack of social support, or the presence of significant life stressors like a death in the family. But there's still a lot for clinicians and researchers to understand about risk factors and how they predict postpartum depression. For example, a recent study examined the presence of adverse childhood events, such as placement out of the home during childhood, and the presence of postpartum depression when those same children grew up and became parents themselves. They noted that the presence of adverse childhood events was strongly predictive of postpartum depression, and that the more childhood events occurred that were adverse in nature, the more likely it was to develop postpartum depression.